Question 1. Quality control measures reveal a recurring pattern of minor safety protocol deviations among nursing staff in the intensive care unit. These deviations, while not resulting in immediate harm, indicate a potential erosion of adherence to established safety procedures. The healthcare organization is subject to U.S. federal regulations governing patient safety and workplace safety. Which of the following approaches best addresses this situation to foster a sustainable safety culture? Option A. Implement mandatory, one-time retraining sessions for all ICU nursing staff on the specific safety protocols that have shown deviations, with a focus on reinforcing the consequences of noncompliance. Option B. Develop and implement a new set of detailed safety checklists for all ICU procedures, requiring supervisors to conduct daily audits of staff adherence without involving the nursing staff in the development process. Option C. Conduct a comprehensive review of existing safety protocols with direct input from ICU nursing staff to identify practical barriers to adherence and collaboratively develop revised procedures or additional support mechanisms. Option D. Issue a memo from senior leadership emphasizing the importance of strict adherence to safety protocols and outlining increased disciplinary actions for future deviations, without further investigation into the causes. The correct answer is C. Conduct a comprehensive review of existing safety protocols with direct input from ICU nursing staff to identify practical barriers to adherence and collaboratively develop revised procedures or additional support mechanisms. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for compliance with the long-term goal of fostering a robust safety culture. A superficial approach to addressing the identified issues might satisfy immediate regulatory scrutiny, but would fail to embed sustainable safety practices. Careful judgment is required to move beyond mere rule following to proactive safety engagement. The correct approach involves actively engaging frontline staff in identifying root causes and developing solutions. This aligns with the principles of a strong safety culture, which emphasizes shared responsibility and continuous improvement. Regulatory frameworks, such as those promoted by OSHA, Occupational Safety and Health Administration, in the U.S., encourage employee involvement in safety programs as a key component of effective hazard identification and control. Ethically, this approach respects the expertise of those closest to the work and empowers them to contribute to their own safety and that of their colleagues. An incorrect approach that focuses solely on retraining without addressing systemic issues fails to tackle the underlying reasons for noncompliance. This can lead to a perception of checking a box rather than genuine safety improvement, potentially violating the spirit, if not the letter, of regulations that mandate effective hazard abatement. Another incorrect approach, which involves solely relying on management directives and disciplinary actions, can foster a climate of fear and discourage open reporting of safety concerns. This is counterproductive to building trust and can lead to underreporting of incidents, hindering the organization's ability to learn and improve, and potentially violating ethical obligations to create a safe working environment. A third incorrect approach, which involves implementing new policies without consulting the affected staff, overlooks the practical realities of their work and may result in policies that are difficult to implement or are perceived as irrelevant, thus failing to achieve the desired safety outcomes and potentially creating new hazards. Professionals should use a decision-making framework that prioritizes understanding the root causes of safety lapses, engaging all levels of the organization in problem-solving, and implementing solutions that are both compliant and culturally sustainable. This involves a continuous cycle of assessment, planning, implementation, and evaluation, with a strong emphasis on communication and feedback. Question 2. Process analysis reveals that a healthcare facility's new patient fall prevention program has been implemented for 1 year. To assess its effectiveness and inform future improvements, which of the following approaches would best demonstrate the program's impact and align with continuous improvement principles? Option A. Documenting the frequency of environmental safety audits conducted within patient care areas. Option B. Tracking the number of staff members who completed the mandatory fall prevention training modules. Option C. Quantifying the reduction in patient falls and associated injuries, and correlating this with patient satisfaction scores related to perceived safety. Option D. Surveying staff to gauge their general perception of the facility's safety culture. The correct answer is C. Quantifying the reduction in patient falls and associated injuries, and correlating this with patient satisfaction scores related to perceived safety. Explanation. This scenario presents a common challenge in healthcare safety, demonstrating the tangible impact of a safety program beyond mere compliance. The professional challenge lies in moving from a reactive, incident-driven approach to a proactive, data-informed strategy that clearly links safety initiatives to improved patient outcomes and operational efficiency. This requires a sophisticated understanding of program evaluation methodologies that can isolate the effect of safety interventions. The correct approach involves a comprehensive impact assessment that quantifies the reduction in adverse events, improved patient satisfaction scores, and potential cost savings directly attributable to the implemented safety program. This aligns with the core principles of continuous improvement mandated by regulatory frameworks such as OSHA General Duty Clause, 29 CFR 1910, 141A, 1I, which requires employers to provide a workplace free from recognized hazards, and the Joint Commission's Environment of Care Standards, which emphasize data-driven decision-making for performance improvement. By focusing on measurable outcomes, this approach provides robust evidence of the program's value and justifies continued investment and refinement. An incorrect approach would be to solely rely on tracking the number of safety training sessions conducted. While training is a component of a safety program, the number of sessions does not inherently demonstrate effectiveness or impact on actual safety outcomes. This fails to meet the regulatory expectation of demonstrating a reduction in hazards and risks. Another incorrect approach would be to focus exclusively on the number of safety audits performed. Audits are valuable for identifying deficiencies, but without subsequent corrective actions and measurement of their impact, they do not constitute a complete program evaluation. This approach neglects the crucial step of assessing the effectiveness of interventions. A third incorrect approach would be to measure program success based on employee feedback regarding perceived safety, without correlating this feedback to objective safety metrics. While employee perception is important, it is subjective and can be influenced by factors unrelated to actual safety performance. Regulatory bodies require objective evidence of hazard reduction. Professionals should employ a decision-making process that begins with clearly defining program objectives and desired outcomes. This should be followed by selecting appropriate evaluation metrics that are both quantitative and qualitative, and that directly link safety interventions to patient care and operational efficiency. Data collection should be systematic and ongoing, allowing for trend analysis and identification of areas for improvement. Finally, findings should be communicated effectively to stakeholders to drive further program enhancement and resource allocation. Question 3. Stakeholder feedback indicates a new, complex surgical procedure involving increased potential for aerosolized particles and direct contact with bodily fluids will be introduced. What is the most appropriate initial step to ensure healthcare worker safety and compliance with federal regulations regarding exposure prevention and control? Option A. Conduct a thorough risk assessment to identify specific hazards and determine appropriate engineering and administrative controls, followed by selection of necessary personal protective equipment. Option B. Ensure all staff receive comprehensive training on the new procedure and general safety protocols. Option C. Procure a sufficient supply of personal protective equipment, including gowns, gloves, and masks, for all staff involved. Option D. Establish a protocol to document and investigate any exposure incidents that occur during the initial implementation of the procedure. The correct answer is A. Conduct a thorough risk assessment to identify specific hazards and determine appropriate engineering and administrative controls, followed by selection of necessary personal protective equipment. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for patient care with the long-term safety of healthcare workers and the environment. The introduction of a new, potentially hazardous procedure necessitates a proactive and systematic approach to exposure prevention and control, rather than a reactive one. Careful judgment is required to ensure that all potential risks are identified and mitigated effectively, adhering to established safety protocols and regulatory requirements. The correct approach involves a comprehensive risk assessment and the implementation of a multi-layered control strategy. This aligns with the principles of the Occupational Safety and Health Administration (OSHA) standards, specifically the General Duty Clause, 29 CFR 1910, 1450, which mandates employers provide a workplace free from recognized hazards. It also directly addresses the bloodborne pathogen standard, 29 CFR 1910. 1030, which requires employers to implement engineering controls, work practice controls, and personal protective equipment, PPE, to minimize occupational exposure to bloodborne pathogens. A thorough risk assessment identifies specific hazards associated with the new procedure, allowing for the selection of appropriate controls, such as enhanced ventilation, specialized equipment, and specific PPE, thereby preventing or minimizing exposure. An incorrect approach that relies solely on the availability of personal protective equipment, PPE, fails to meet regulatory requirements. While PPE is a crucial component of exposure control, it is considered the last line of defense. OSHA regulations emphasize the hierarchy of controls, prioritizing engineering and administrative controls over PPE. Relying only on PPE ignores the potential for breaches in protection and does not address the root cause of the hazard. Another incorrect approach that involves waiting for an incident to occur before implementing controls is ethically and regulatorily unacceptable. This reactive stance violates the proactive mandate of OSHA and demonstrates a failure to uphold the employer's responsibility to provide a safe working environment. Such an approach significantly increases the risk of worker injury and potential regulatory penalties. A third incorrect approach that focuses only on training without implementing physical controls is also insufficient. While comprehensive training on safe handling procedures and the use of PPE is vital, it is not a substitute for engineering or administrative controls that physically reduce or eliminate the hazard at its source. Training alone does not prevent exposure if the environment or equipment poses an inherent risk. The professional decision-making process for similar situations should involve a systematic risk management framework. This begins with hazard identification, followed by risk assessment to determine the likelihood and severity of potential exposures. Based on this assessment, a hierarchy of controls should be applied, starting with elimination or substitution, then engineering controls, administrative controls, and finally, PPE. Continuous monitoring and evaluation of control effectiveness are also essential to ensure ongoing safety and compliance. Question 4. Strategic planning requires a comprehensive approach to managing potential risks within a healthcare setting. Following a near-miss incident involving a medication administration error, which of the following investigative strategies best aligns with the principles of effective healthcare safety management and regulatory compliance? Option A. Immediately identify the nurse who administered the incorrect medication and implement disciplinary measures to ensure accountability. Option B. Document the near miss in the incident reporting system, but deem further investigation unnecessary as no patient harm occurred. Option C. Conduct a thorough root cause analysis, RCA, utilizing a structured methodology to identify all contributing factors, both human and systemic, and develop targeted preventive actions. Option D. Rely on the immediate supervisor's assessment of the situation and implement a verbal warning to the involved staff member. The correct answer is C. Conduct a thorough root cause analysis, RCA, utilizing a structured methodology to identify all contributing factors, both human and systemic, and develop targeted preventive actions. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare safety. A near-miss event that, while not resulting in immediate harm, signals a potential systemic weakness. The professional challenge lies in conducting a thorough and objective investigation that moves beyond superficial explanations to identify underlying causes, thereby preventing future, potentially more severe, incidents. The requirement for careful judgment stems from the need to balance the urgency of addressing the risk with the thoroughness of the investigation, ensuring that all contributing factors are considered without prematurely assigning blame. Correct approach analysis. The correct approach involves a systematic, multifaceted investigation that prioritizes identifying the root cause. This aligns with the principles of continuous quality improvement and patient safety mandated by regulatory bodies such as the Joint Commission, in the U.S. context, which is the assumed jurisdiction for CHSP unless otherwise specified. Specifically, regulatory frameworks emphasize a non-punitive approach to reporting and investigating adverse events and near misses, focusing on system vulnerabilities rather than individual culpability. Utilizing a structured root cause analysis, RCA methodology, such as the 5 whys or fishbone diagrams, allows for a deep dive into the sequence of events, contributing factors, and underlying system issues. This approach is ethically sound, as it aims to protect patients and staff by improving safety processes. Incorrect approach is analysis, an approach that focuses solely on identifying the individual directly involved and implementing immediate disciplinary action, is ethically and regulatorily flawed. This punitive approach discourages reporting of near misses and errors, creating a culture of fear rather than a culture of safety. It fails to address the systemic issues that likely contributed to the event, meaning similar incidents are likely to recur. Regulatory bodies strongly advocate against this type of blame-oriented investigation, an approach that dismisses the near miss as insignificant because no harm occurred overlooks the proactive nature of safety management. Regulatory guidelines emphasize the importance of investigating near misses as valuable learning opportunities to prevent future harm. Ignoring such events is a failure to adhere to best practices in risk management and a missed opportunity for system improvement, potentially leading to a violation of organizational safety policies and a disregard for patient safety principles. An approach that relies on anecdotal evidence and assumptions without a structured investigation is also professionally unacceptable. This method lacks objectivity and rigor, making it unlikely to uncover the true root cause. It can lead to the implementation of ineffective corrective actions, wasting resources and failing to enhance safety. Regulatory frameworks demand evidence-based decision-making and a systematic approach to incident analysis. Professional reasoning. Professionals should adopt a systematic and objective approach to incident investigation. This involves 1. Immediate containment of the risk, if any. 2. Assembling a multidisciplinary investigation team. 3. Gathering all relevant data and evidence. 4. Applying a recognized RCA methodology to identify causal and contributing factors. 5. Developing and implementing effective, sustainable corrective and preventive actions. And 6. Monitoring the effectiveness of these actions. The focus should always be on system improvement and learning, fostering a culture where safety is paramount and reporting is encouraged. Question 5. Benchmark analysis indicates that a healthcare facility is developing its comprehensive safety program. Which of the following approaches best ensures compliance with OSHA standards specific to healthcare settings, considering the interconnectedness of various safety requirements? Option A. Developing a robust bloodborne pathogens exposure control plan and ensuring all staff are trained on its provisions. Option B. Integrating OSHA bloodborne pathogen standard, hazard communication standard, and emergency preparedness requirements into a unified safety management system. Option C. Creating a general emergency action plan that outlines evacuation procedures and communication protocols for various emergencies. Option D. Implementing a thorough hazard communication program that includes maintaining safety data sheets for all chemicals and providing employee training on chemical hazards. The correct answer is A. Developing a robust bloodborne pathogens exposure control plan and ensuring all staff are trained on its provisions. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare safety, ensuring compliance with multiple, overlapping OSHA standards in a dynamic environment. The professional must not only identify the relevant standards, but also prioritize their application based on the immediate risk and the specific context of the healthcare setting. The challenge lies in the potential for misinterpretation or incomplete implementation of these standards, which can lead to significant patient and employee safety risks, as well as regulatory penalties. Careful judgment is required to balance immediate needs with long-term compliance strategies. Correct approach analysis. The correct approach involves a comprehensive review and integration of OSHA bloodborne pathogen standard, 29 CFR 1910, 1030, hazard communication standard, 29 CFR 1910, 1200, and standards related to emergency preparedness and response, such as those concerning emergency action plans, 29 CFR 1910, 38, and fire prevention plans, 29 CFR 1910, 39. This approach is correct because it acknowledges that these standards are not isolated but interconnected in ensuring a safe healthcare environment. Specifically, it recognizes that effective hazard communication is crucial for the proper implementation of the bloodborne pathogen standard, and that robust emergency preparedness plans must account for the unique hazards present in a healthcare setting, including those covered by the bloodborne pathogen standard. This integrated strategy ensures that all relevant regulatory requirements are addressed systematically, leading to a more effective and holistic safety program. Incorrect approach is analysis. Focusing solely on the bloodborne pathogen standard, while critical, is an incomplete approach. This fails to address other significant hazards and regulatory requirements, such as the safe handling and labeling of hazardous chemicals, hazard communication, or the procedures for responding to emergencies beyond those directly related to bloodborne pathogens. This narrow focus leaves the organization vulnerable to violations of other OSHA standards and exposes employees and patients to preventable risks. Prioritizing only hazard communication without adequately addressing the specific risks and control measures mandated by the bloodborne pathogen standard is also a failure. While understanding chemical hazards is vital, it does not encompass the unique transmission routes and protective measures required for bloodborne diseases, which are a primary concern in healthcare. This oversight can lead to inadequate engineering controls, personal protective equipment use, and post-exposure protocols. Implementing general emergency preparedness measures without specifically integrating the requirements of the bloodborne pathogen standard and hazard communication standard is another flawed approach. While a general emergency plan is necessary, it must be tailored to the specific hazards of the healthcare environment, including the potential for exposure to infectious agents and hazardous materials during emergencies. A generic plan may not provide sufficient detail or guidance for these critical areas. Professional reasoning. Professionals should adopt a systematic and integrated approach to OSHA compliance. This involves 1. Hazard identification. Conducting thorough assessments to identify all potential hazards present in the healthcare setting, referencing relevant OSHA standards. 2. Regulatory review. Understanding the specific requirements of applicable OSHA standards, such as 29 CFR 1910, 1030 29 CFR 1910, 1200 29 CFR 1910, 38, and 29 CFR 1910, 39. 3. Program development. Creating comprehensive safety programs that address each identified hazard and comply with all relevant regulatory mandates. This includes developing policies, procedures, training materials, and control measures. 4. Integration. Ensuring that different safety programs are interconnected and mutually reinforcing. For example, hazard communication training should inform employees about the risks associated with bloodborne pathogens and the proper use of PPE. 5. Training and education. Providing regular and effective training to all employees on relevant safety procedures and regulatory requirements. 6. Monitoring and evaluation. Regularly reviewing the effectiveness of safety programs, conducting audits, and updating procedures as necessary to maintain compliance and improve safety performance. Question 6. The control framework reveals that a healthcare organization's current safety protocol are not consistently aligned with evolving best practices and emerging risks. To address this, what is the most effective and compliant strategy for identifying and rectifying these discrepancies? Option A. Focus the assessment exclusively on ensuring adherence to the minimum requirements outlined in current federal and state healthcare safety regulation. Option B. Assign the entire responsibility for the needs assessment and gap analysis to the Environmental Services Department, as they have direct oversight of facility maintenance. Option C. Conduct a comprehensive, data-driven needs assessment and gap analysis involving interdisciplinary teams to benchmark current practices against regulatory requirements and industry standards, followed by the development of targeted improvement plans. Option D. Primarily rely on analyzing incident reports and patient complaints to identify areas requiring safety improvements, as these represent the most direct evidence of system failures. The correct answer is C. Conduct a comprehensive, data-driven needs assessment and gap analysis involving interdisciplinary teams to benchmark current practices against regulatory requirements and industry standards, followed by the development of targeted improvement plans. Explanation. This scenario is professionally challenging because it requires a healthcare organization to proactively identify and address potential safety deficiencies before they lead to adverse events or regulatory noncompliance. A robust needs assessment and gap analysis are foundational to establishing and maintaining an effective safety management system. The difficulty lies in ensuring the assessment is comprehensive, accurate, and leads to actionable improvements that align with regulatory expectations. The correct approach involves systematically evaluating current safety practices against established standards and identifying areas where performance falls short. This process should be data-driven, involving input from various stakeholders and utilizing appropriate assessment tools. Regulatory justification stems from the fundamental requirement of healthcare facilities to provide a safe environment for patients and staff, as mandated by agencies like the Joint Commission, if applicable to the CHSP jurisdiction, or CMS, which expect organizations to have processes in place for continuous improvement and risk mitigation. Ethical considerations demand a commitment to patient safety and quality care, which necessitates identifying and rectifying safety gaps. An incorrect approach that relies solely on reported incidents fails to capture latent hazards or near misses, which are critical indicators of systemic weaknesses. This approach is ethically deficient as it is reactive rather than proactive, potentially allowing harm to occur before it is addressed. It also likely falls short of regulatory expectations for a comprehensive safety program. Another incorrect approach that focuses only on compliance with specific, narrowly defined regulations overlooks broader safety principles and best practices. While regulatory adherence is essential, a true needs assessment should encompass a wider scope of potential risks and opportunities for improvement, including those not explicitly detailed in every regulation. This approach risks creating a check-the-box mentality rather than fostering a culture of safety. A third incorrect approach that delegates the entire needs assessment to a single department without interdisciplinary input is flawed because safety is an organizational responsibility. This siloed approach can lead to blind spots, incomplete data, and a lack of buy-in from other areas, hindering the implementation of effective solutions. It fails to leverage the collective knowledge and experience necessary for a holistic safety assessment. The professional reasoning process for similar situations should involve 1. Defining the scope and objectives of the needs assessment, aligning them with organizational goals and regulatory requirements. 2. Selecting appropriate methodologies and tools for data collection and analysis. 3. Engaging relevant stakeholders across all levels and departments. 4. Analyzing findings to identify specific gaps and prioritize areas for improvement. 5. Developing and implementing a corrective action plan with clear timelines and responsibilities. 6. Establishing mechanisms for ongoing monitoring and evaluation of the effectiveness of implemented changes. Question 7. The monitoring system demonstrates a significant spill of blood and body fluids in a patient care area, and the immediate response involves staff donning personal protective equipment, containing the spill with absorbent pads, and then proceeding to clean the area with soap and water followed by a standard surface disinfectant. Option A. Wipe the spill with paper towels and discard them, then clean the area with soap and water. Option B. Proceed with the described cleanup and disinfection protocol. Option C. Immediately use an EPA-approved disinfectant effective against bloodborne pathogens on the spill, followed by absorbent material, and then dispose of waste. Option D. Delay the cleanup until the end of the shift to minimize disruption to patient care. The correct answer is B. Proceed with the described cleanup and disinfection protocol. Explanation. Scenario analysis. This scenario is professionally challenging because it requires immediate and effective action to mitigate potential health risks to patients, staff, and visitors. A failure in blood and body fluid spill management can lead to the transmission of infectious diseases, environmental contamination, and legal repercussions for the healthcare facility. The professional must balance the urgency of the situation with adherence to established protocols and regulatory requirements. Correct approach analysis. The correct approach involves immediate containment of the spill, followed by appropriate disinfection and disposal procedures as outlined by the facility's infection control plan and relevant regulatory guidelines. This ensures that the infectious material is neutralized, the environment is decontaminated, and waste is handled safely, thereby preventing further transmission and protecting public health. This aligns with the principles of infection prevention and control mandated by regulatory bodies like OSHA, Occupational Safety and Health Administration, in the U.S., which emphasizes the employer's responsibility to provide a safe working environment and implement appropriate hazard control measures for bloodborne pathogens. Incorrect approaches analysis. an approach that involves simply wiping the spill with paper towels and discarding them without using appropriate disinfectant fails to neutralize the infectious agents present. This poses a significant risk of cross-contamination and disease transmission, violating infection control principles and potentially OSHA bloodborne pathogen standard 29 CFR 1910-1030, which mandates specific decontamination procedures, an approach that delays reporting the spill and initiating cleanup until the end of the shift overlooks the immediate hazard. Prolonged exposure to an untreated spill increases the risk of transmission and environmental contamination, demonstrating a lack of diligence and potentially violating facility policies and regulatory expectations for prompt hazard response. An approach that uses only water to clean the spill is insufficient. Water alone does not effectively kill or inactivate most pathogens found in blood and body fluids. This approach fails to achieve adequate disinfection, leaving the area contaminated and posing a continued risk, which is contrary to the requirements for effective decontamination under infection control standards. Professional reasoning. Professionals should follow a systematic approach to blood and body fluid spill management. This includes 1. Assessing the situation and ensuring personal safety, e.g., donning appropriate PPE. 2. Containing the spill to prevent its spread. 3. Cleaning and disinfecting the affected area using EPA-approved disinfectants effective against bloodborne pathogens. 4. Properly disposing of contaminated materials. 5. Documenting the incident and cleanup. This process ensures compliance with regulatory mandates and upholds ethical responsibilities to protect patient and staff safety. Question 8. The efficiency study reveals that the current process for addressing findings from internal compliance audits and inspections is time-consuming and resource-intensive. To streamline operations, the Safety Committee is considering alternative methods for managing audit outcomes. Which of the following approaches best balances efficiency with the imperative of maintaining a safe healthcare environment and adhering to regulatory requirements? Option A. Rely on informal discussions among department heads to determine the urgency and scope of corrective actions for audit findings. Option B. Prioritize addressing only those audit findings that are easily corrected or have a low immediate perceived risk, deferring more complex issues. Option C. Implement a risk-based prioritization system for corrective actions, focusing first on findings with the highest potential impact on patient safety and regulatory compliance, and documenting all actions taken. Option D. Postpone the implementation of corrective actions for all audit findings until the next scheduled external regulatory inspection to consolidate efforts. The correct answer is C. Implement a risk-based prioritization system for corrective actions, focusing first on findings with the highest potential impact on patient safety and regulatory compliance, and documenting all actions taken. Explanation. This scenario presents a professional challenge due to the inherent tension between maintaining operational efficiency and ensuring robust compliance with healthcare safety regulations. The healthcare environment is highly regulated, and any perceived shortcut or deviation from established protocols, even if intended to improve efficiency, can have significant patient safety and legal ramifications. Careful judgment is required to balance these competing demands, ensuring that efficiency gains do not compromise the integrity of safety systems or regulatory adherence. The correct approach involves a systematic and documented review of audit findings, prioritizing corrective actions based on risk assessment and regulatory mandates. This approach is professionally sound because it directly addresses identified deficiencies in a structured manner, aligning with the principles of continuous quality improvement and regulatory compliance. Specifically, it adheres to the spirit and letter of regulations that require healthcare facilities to identify and mitigate hazards, implement corrective actions, and maintain records of these processes. This proactive and evidence-based method ensures that resources are allocated effectively to address the most critical safety issues, thereby protecting patients and staff and avoiding potential penalties. An incorrect approach that focuses solely on addressing findings that are easily rectified or that have minimal immediate impact is professionally unacceptable. This failure stems from a disregard for the potential severity of overlooked hazards and a lack of adherence to regulatory requirements that mandate a comprehensive approach to risk management. Such an approach risks patient harm and regulatory noncompliance, as it prioritizes convenience over safety. Another incorrect approach, which involves delaying corrective actions until the next scheduled audit or inspection, is also professionally flawed. This delay demonstrates a lack of urgency in addressing safety deficiencies and can lead to prolonged exposure to risks. Regulations typically require prompt action to correct identified hazards, and such procrastination can be interpreted as negligence, potentially resulting in severe consequences for the organization and its leadership. Finally, an approach that relies on anecdotal evidence or informal discussions to determine the priority of corrective action, rather than objective data and risk assessment, is professionally unsound. This method lacks the rigor required for effective safety management and can lead to misallocation of resources and the overlooking of critical issues. Professional decision-making in healthcare safety requires a data-driven, risk-informed, and systematically documented process that prioritizes patient well-being and regulatory compliance above all else. Question 9. The evaluation methodology shows a healthcare organization experiencing challenges in ensuring all staff members, from clinical practitioners to administrative support personnel, are consistently informed about updated infection control protocols. This leads to varying levels of adherence across departments. Which communication strategy best addresses this challenge while adhering to U.S. healthcare safety regulations and best practices? Option A. Disseminate all updated infection control protocols exclusively through the hospital's internal email system, assuming all employees regularly check their work email. Option B. Distribute a detailed, technical document outlining the updated protocols via the hospital's intranet, with a requirement for staff to acknowledge receipt of the document. Option C. Implement a comprehensive communication plan that utilizes a blend of digital alerts, mandatory in-person safety briefings for each shift, and visually engaging posters in high-traffic areas, with a feedback mechanism for staff to confirm understanding. Option D. Rely on department managers to verbally relay updated protocols during their weekly team meetings, with the expectation that all staff will attend these meetings. The correct answer is C. Implement a comprehensive communication plan that utilizes a blend of digital alerts, mandatory in-person safety briefings for each shift, and visually engaging posters in high-traffic areas, with a feedback mechanism for staff to confirm understanding. Explanation. The evaluation methodology shows a healthcare facility struggling to effectively communicate critical safety information to diverse staff groups, leading to potential breaches in patient care and staff safety protocols. This scenario is professionally challenging because it requires balancing the need for timely and accurate information dissemination with the varied communication preferences, literacy levels, and roles of different healthcare professionals. Effective communication is not merely about transmitting data. It's about ensuring comprehension, fostering engagement, and driving behavioral change to uphold safety standards. The challenge lies in tailoring messages and delivery methods to resonate with each audience, thereby minimizing misinterpretation and maximizing adherence to safety guidelines. The correct approach involves a multimodal communication strategy that leverages various channels and formats to reach all staff members. This includes utilizing a combination of digital platforms, e.g., secure internal messaging systems, email alerts, in-person methods, e.g., team huddles, safety briefings, departmental meetings, and visual aids, e.g., posters, infographics in common areas. This approach is correct because it aligns with best practices in organizational communication and is implicitly supported by regulatory frameworks that mandate clear, accessible, and timely communication of safety information to all personnel. For instance, OSHA General Duty Clause 29 CFR 1910-119A requires employers to provide a workplace free from recognized hazards, which necessitates effective communication of safety procedures. Similarly, the Joint Commission's National Patient Safety Goals emphasize clear communication as a cornerstone of patient safety. By employing a diverse range of communication methods, the facility increases the likelihood that critical safety updates will be received, understood, and acted upon by all staff, regardless of their role or preferred learning style. An approach that relies solely on email for all safety communications is incorrect. This fails to account for staff who may not have consistent access to email, those who are not digitally proficient, or those who may overlook important messages in a crowded inbox. This can lead to a failure to comply with regulatory requirements for ensuring all employees are aware of and trained on safety protocols. Another incorrect approach is to only communicate safety information during scheduled staff meetings. This method is insufficient because it limits communication to specific times, potentially delaying the dissemination of urgent safety alerts. It also excludes staff who may be on different shifts or who are unable to attend these meetings, creating communication gaps and increasing the risk of noncompliance with safety standards. Finally, an approach that uses highly technical jargon without simplification is also flawed. While appropriate for certain specialized audiences, it can alienate or confuse staff members from different disciplines, leading to misunderstanding and non-adherence to safety instructions. This directly contravenes the principle of clear and understandable communication mandated by safety regulations, which aim to protect all workers. The professional reasoning process for similar situations should involve a thorough assessment of the target audience's communication needs and preferences. This includes considering their roles, literacy levels, access to technology, and preferred methods of information intake. A risk-based approach should then be applied, prioritizing the most critical safety information for immediate and widespread dissemination through multiple channels. Regular feedback mechanisms should be established to gauge the effectiveness of communication strategies and to make necessary adjustments, ensuring continuous improvement in safety culture and compliance. Question 10. The control framework reveals that a newly developed patient safety monitoring system, designed to proactively identify and mitigate potential harm, is ready for implementation. However, the Finance Department has raised concerns about the significant upfront capital expenditure required, suggesting a delay in implementation until the next fiscal year or exploring a less robust, lower-cost alternative. The Chief Nursing Officer is advocating for immediate implementation, citing potential patient safety risks associated with the current system's limitations and the clear mandate from accreditation standards for robust safety monitoring. What is the most ethically and regulatorily sound approach for the healthcare organization's leadership to take? Option A. Prioritize the immediate implementation of the new patient safety monitoring system, seeking creative funding solutions or phased implementation to manage the financial impact while ensuring full compliance with accreditation standards. Option B. Request a temporary waiver from accreditation standards related to patient safety monitoring, citing the organization's current financial constraints. Option C. Implement a less comprehensive and lower-cost patient safety monitoring system to address immediate budgetary concerns, even if it does not fully meet the capabilities of the proposed advanced system. Option D. Delay the implementation of the new patient safety monitoring system until the next fiscal year to align with budget cycles, accepting the potential for increased patient safety risks in the interim. The correct answer is A. Prioritize the immediate implementation of the new patient safety monitoring system, seeking creative funding solutions or phased implementation to manage the financial impact while ensuring full compliance with accreditation standards. Explanation. This scenario presents a professional challenge due to the inherent conflict between immediate operational pressures and the long-term commitment to patient safety and regulatory compliance mandated by accreditation standards. The healthcare organization's leadership is facing a decision that could impact both its financial standing and its ability to provide safe patient care, directly engaging with the core principles of healthcare safety and ethical governance. Careful judgment is required to balance these competing demands while upholding the organization's mission and its accreditation status. The correct approach involves prioritizing the implementation of the new patient safety monitoring system, even with the initial financial strain. This aligns directly with accreditation standards, such as those from the Joint Commission, which emphasize a proactive approach to patient safety and the continuous improvement of care processes. Ethically, this decision upholds the principle of non-maleficence by actively working to prevent harm to patients. Regulatory justification stems from the explicit requirements of accreditation bodies to have robust systems in place for identifying and mitigating risks, which a new monitoring system directly addresses. This approach demonstrates a commitment to patient well-being and a willingness to invest in the infrastructure necessary for safe, high-quality healthcare delivery, which is a fundamental expectation of accredited organizations. An incorrect approach would be to delay the implementation of the new patient safety monitoring system due to budget constraints. This fails to acknowledge the paramount importance of patient safety as dictated by accreditation standards. The ethical failure lies in potentially exposing patients to preventable harm by foregoing a system designed to identify and mitigate risks. Regulatory failure occurs because this decision directly contravenes the spirit and letter of accreditation requirements that mandate proactive risk management and continuous improvement in patient care processes. Another incorrect approach would be to implement a less comprehensive or less effective monitoring system to reduce initial costs. This represents a superficial compliance with accreditation standards rather than a genuine commitment to patient safety. The ethical failure is similar to delaying implementation, as it still falls short of providing the best possible protection for patients. The regulatory failure is that, while some system might be in place, it may not meet the rigorous standards for effectiveness and comprehensiveness expected by accrediting bodies, potentially leading to a finding of noncompliance during surveys. A third incorrect approach would be to seek a waiver from accreditation standards regarding the monitoring system, citing financial hardship. While waivers can be considered in exceptional circumstances, using financial constraints as a primary reason to bypass a critical patient safety requirement is generally not permissible under accreditation frameworks. The ethical failure is the abdication of responsibility to ensure the highest level of patient safety. The regulatory failure is that accreditation standards are designed to ensure a minimum level of safety and quality, and seeking to circumvent these due to financial reasons undermines the entire purpose of accreditation. The professional decision-making process for similar situations should involve a thorough risk assessment, considering the potential harm to patients if the safety system is not implemented or is inadequately implemented. This should be coupled with a comprehensive review of accreditation standards to understand the specific requirements and expectations. Engaging relevant stakeholders, including clinical staff, risk management, finance, and leadership, is crucial for a balanced perspective. Exploring all available funding options, phased implementation strategies, or alternative cost-effective solutions that still meet safety standards should be considered. Ultimately, the decision must be guided by the principle that patient safety is non-negotiable, and that accreditation standards are a framework for achieving and maintaining that safety. Question 11. What factors determine the adequacy and completeness of documentation and record-keeping for healthcare safety incidents, ensuring compliance with regulatory frameworks and best practices? Option A. The speed at which incident reports are filed, with a focus on capturing only the most critical immediate details to expedite resolution. Option B. The extent to which documentation includes a detailed account of the incident, the investigation process, root cause analysis, corrective actions taken, and evidence of follow-up, all aligned with applicable regulatory requirements and organizational policies. Option C. The inclusion of only those details that are easily retrievable and require minimal effort to document, regardless of regulatory mandates. Option D. The use of informal communication channels and personal notes to track safety concerns, prioritizing ease of access for immediate reference. The correct answer is B. The extent to which documentation includes a detailed account of the incident, the investigation process, root cause analysis, corrective actions taken, and evidence of follow-up, all aligned with applicable regulatory requirements and organizational policies. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare safety professional to balance the immediate need for efficient incident reporting with the long-term imperative of maintaining accurate, accessible, and legally compliant documentation. The pressure to quickly resolve issues can sometimes lead to shortcuts in documentation, which can have severe repercussions later. Ensuring that all required elements are captured, even under time constraints, demands a systematic and thorough approach, adhering strictly to regulatory mandates and organizational policies. Correct approach analysis. The correct approach involves a comprehensive review of all available documentation, including incident reports, investigation findings, corrective action plans, and any supporting evidence, to ensure completeness and accuracy against established regulatory requirements and organizational policies. This approach is best professional practice because it directly addresses the core principles of healthcare safety documentation, which are rooted in regulatory compliance, e.g., OSHA, Joint Commission standards for healthcare organizations, and ethical obligations to maintain a transparent and accountable safety program. Thorough documentation is critical for demonstrating compliance, identifying trends, supporting continuous improvement initiatives, and providing a defensible record in case of audits or legal challenges. It ensures that the organization can effectively learn from incidents and prevent recurrence. Incorrect approach is analysis. Relying solely on verbal summaries or informal notes for documentation is professionally unacceptable because it fails to meet the fundamental requirements for auditable and legally defensible records. Such informal methods lack the specificity, detail, and permanence required by regulations and can be easily misinterpreted or lost, leading to compliance failures and hindering effective root cause analysis. Accepting incomplete incident reports without follow-up to gather all necessary details is also professionally unsound. This approach compromises the integrity of the safety data, making it difficult to conduct thorough investigations or identify systemic issues. Regulatory bodies often mandate specific information to be included in incident reports, and failing to ensure this completeness can result in citations and penalties. Focusing only on immediate corrective actions without documenting the investigation process and its findings is a significant ethical and regulatory failure. The investigation process is crucial for understanding the root cause of an incident, which is essential for developing effective and sustainable preventive measures. Omitting this crucial step undermines the purpose of incident reporting and safety management systems, potentially leading to recurring incidents. Professional reasoning. Healthcare safety professionals should employ a decision-making process that prioritizes adherence to regulatory frameworks, such as those established by OSHA for workplace safety and accreditation bodies like the Joint Commission for Patient Safety, and organizational policies governing documentation. When faced with documentation requirements, the process should involve 1. Identifying all applicable regulatory and policy mandates for the specific type of documentation, e.g., incident reports, hazard assessments. 2. Establishing clear protocols for data collection and record-keeping that ensure completeness, accuracy, and accessibility. 3. Implementing a system for regular review and validation of documentation to confirm compliance and identify any gaps. 4. Prioritizing thoroughness and accuracy over speed, understanding that incomplete or inaccurate records can lead to greater risks and liabilities than a slight delay in reporting. Question 12. Examination of the data shows a consistent pattern of minor safety incidents and a low rate of hazard reporting within the facility's critical care units. The Chief Nursing Officer has expressed concern about the perceived lack of employee engagement in safety initiatives, while the Chief Executive Officer has emphasized the need to maintain high patient throughput. As the Director of Safety, what is the most effective approach to foster a stronger culture of safety, ensuring both leadership commitment and robust employee involvement? Option A. Focus on enhancing the efficiency of incident reporting systems to expedite the documentation of all safety events, thereby ensuring that all occurrences are captured for future analysis. Option B. Implement a comprehensive safety communication plan that includes regular safety briefings from senior leadership, establishment of anonymous reporting channels for hazards and near misses, and the integration of safety performance metrics into departmental goals, with visible leadership participation in safety walkarounds. Option C. Reiterate to unit managers the importance of patient throughput and instruct them to address any safety concerns that directly impede workflow, while deferring broader safety initiatives to the safety department. Option D. Delegate the responsibility for improving safety reporting to the safety officer, who will then develop and distribute safety newsletters and conduct periodic training sessions on hazard identification for unit staff. The correct answer is B. Implement a comprehensive safety communication plan that includes regular safety briefings from senior leadership, establishment of anonymous reporting channels for hazards and near misses, and the integration of safety performance metrics into departmental goals, with visible leadership participation in safety walkarounds. Explanation. This scenario is professionally challenging because it requires balancing immediate operational needs with the fundamental principles of a robust safety culture, specifically concerning leadership commitment and employee involvement. A healthcare facility's commitment to safety is not merely a compliance exercise, but a core ethical and operational imperative, directly impacting patient care and staff well-being. Effective safety management hinges on visible leadership support and the active participation of all staff. The correct approach, which involves a multifaceted strategy that includes direct leadership engagement, clear communication channels for employee feedback, and the integration of safety into daily workflows, represents best professional practice. This aligns with the core tenets of healthcare safety regulations and ethical guidelines that mandate a proactive and inclusive approach to risk management. Specifically, regulatory frameworks often emphasize the importance of a culture of safety, where leadership sets the tone and employees feel empowered to report concerns without fear of reprisal. This approach fosters continuous improvement by leveraging the frontline knowledge of staff and demonstrating that safety is a shared responsibility, driven from the top. An approach that relies solely on the safety officer to disseminate information and collect feedback without direct leadership involvement fails to establish the necessary organizational commitment. This creates a perception that safety is a secondary concern, managed by a specific department rather than being an organizational priority. This can lead to a breakdown in communication and a lack of trust, hindering the reporting of near misses and hazards. Ethically, it falls short of the leadership's responsibility to champion a safe environment. An approach that focuses only on reactive measures, such as addressing incidents after they occur, neglects the proactive and preventative aspects of safety management. While incident investigation is crucial, it is insufficient on its own. Regulations and ethical standards require a forward-looking approach that identifies and mitigates risks before they lead to harm. This reactive stance fails to foster a culture of continuous improvement and can perpetuate systemic safety issues. An approach that prioritizes efficiency and patient throughput above all else, treating safety as an impediment, directly contradicts established healthcare safety principles and regulations. Patient safety and staff safety are inextricably linked to operational efficiency, not opposed to it. Compromising safety for perceived efficiency leads to increased risks of errors, adverse events, and potential harm, which is ethically unacceptable and a violation of regulatory mandates. The professional decision-making process for similar situations should involve a systematic evaluation of the current safety culture, identifying gaps in leadership commitment and employee involvement. This requires engaging with all levels of staff to understand their perspectives and concerns. The framework should then prioritize strategies that demonstrably strengthen leadership visibility in safety matters, establish clear and accessible reporting mechanisms for employees, and integrate safety considerations into all decision-making processes, from strategic planning to daily operation. This ensures that safety is not an afterthought, but a foundational element of the organization's identity and functioning. Question 13. When evaluating the development of new safety policies and procedures for a healthcare facility, which approach best ensures both regulatory compliance and effective integration into daily practice? Option A. Updating policies based on a review of recent incident reports without consulting staff or considering broader regulatory changes. Option B. Conducting a comprehensive review of existing policies against current regulatory standards, actively involving frontline staff in the development process, and implementing a phased rollout with robust training and feedback mechanisms. Option C. Implementing policies immediately after a top-down review by senior management, assuming staff will adapt without specific training or input. Option D. Relying solely on an external safety consulting firm to draft all new policies based on their general expertise in healthcare safety regulations. Correct answer is B. Conducting a comprehensive review of existing policies against current regulatory standards, actively involving frontline staff in the development process, and implementing a phased rollout with robust training and feedback mechanisms. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare safety, balancing the need for comprehensive, up-to-date policies with the practical realities of implementation and staff engagement. The professional challenge lies in developing safety policies that are not only compliant with regulatory requirements, but also effectively integrated into daily practice, fostering a culture of safety rather than mere compliance. This requires careful consideration of stakeholder input, resource allocation, and the practical usability of the policies. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes stakeholder engagement and practical implementation. This begins with a thorough review of existing policies against current regulatory frameworks, such as those mandated by OSHA, Occupational Safety and Health Administration, for workplace safety in healthcare settings, and specific healthcare accreditation standards. Crucially, it involves actively seeking input from frontline staff who will be directly affected by the policies. This collaborative development process ensures that policies are not only legally sound, but also practical, understandable, and aligned with the daily workflow. Pilot testing and phased implementation, coupled with comprehensive training and ongoing monitoring, are essential for successful adoption and continuous improvement. This aligns with the ethical imperative to protect patient and staff safety and the regulatory requirement to maintain a safe working environment. Incorrect approach is analysis. Implementing policies solely based on a top-down review without staff input risks creating policies that are impractical or misunderstood, leading to non-compliance and potential safety lapses. This fails to address the human element of safety culture. Relying exclusively on external consultants, while potentially bringing expertise, can result in policies that are not tailored to the specific organizational context and culture, potentially overlooking critical internal operational nuances. This can also lead to a lack of buy-in from internal staff. Developing policies without a clear implementation and training plan, even if compliant on paper, will likely result in poor adherence and a failure to achieve desired safety outcomes. This neglects the practical application of safety principles and the importance of education in fostering a safe environment. Professional reasoning. Professionals should approach policy development by first understanding the regulatory landscape and identifying gaps. This should be followed by a robust stakeholder engagement process, involving those who will implement and be affected by the policies. A phased implementation with clear communication, training, and mechanisms for feedback and continuous improvement is paramount. This iterative process ensures that policies are not only compliant, but also effective in promoting a strong safety culture. Question 14. Compliance review shows that the hospital's safety committee is evaluating methodologies for identifying and assessing hazards associated with direct patient care activities. They are considering several approaches to improve their existing safety program. Which of the following approaches would best align with the principles of proactive hazard identification and comprehensive risk assessment in a healthcare setting? Option A. Relying primarily on the analysis of past patient incident reports to identify areas for safety improvement. Option B. Implementing a detailed job hazard analysis (JHA) for all critical patient care tasks, augmented by a failure mode and effects analysis (FME) to evaluate the potential impact of identified failure points. Option C. Conducting a broad, facility-wide environmental hazard survey to identify general safety concerns across the institution. Option D. Utilizing a risk assessment tool that focuses exclusively on the probability of an adverse event occurring, without a detailed assessment of the severity of potential patient harm. The correct answer is B. Implementing a detailed job hazard analysis (JHA) for all critical patient care tasks, augmented by a failure mode and effects analysis (FME) to evaluate the potential impact of identified failure points. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare safety, ensuring that hazard identification and assessment methodologies are not only implemented, but also effectively tailored to the unique complexities of patient care environments. The challenge lies in selecting an approach that balances thoroughness with practicality, considering the dynamic nature of healthcare tasks and the potential for cascading failures. A superficial or overly rigid application of a methodology can lead to missed hazards or an unmanageable workload, while an overly simplistic approach may fail to identify critical risks. Professional judgment is required to select and adapt methodologies to the specific context of patient care, ensuring that the chosen approach is robust enough to identify significant hazards while remaining practical for implementation by healthcare professionals. Correct approach analysis. The correct approach involves utilizing a methodology that systematically breaks down patient care tasks into individual steps, identifying potential failure points at each stage and assessing their potential impact. This aligns with the principles of job hazard analysis (JHA), which is designed to identify hazards associated with specific jobs or tasks. In a healthcare setting, this translates to analyzing the steps involved in administering medication, performing a surgical procedure, or even transferring a patient. By examining each step, potential hazards e.g., incorrect dosage, contaminated equipment, patient falls can be identified. Furthermore, considering the potential consequences of these failures, as in failure mode and effects analysis (FME), allows for prioritization of risks and the development of targeted mitigation strategies. This combined approach is crucial for a certified healthcare safety professional, CHSP, as it directly addresses the identification and assessment of hazards within the operational context of healthcare delivery, aligning with the overarching goal of patient safety and regulatory compliance. Incorrect approach is analysis, focusing solely on a broad, facility-wide risk assessment without task-specific analysis is an insufficient approach. While facility-wide assessments are important for identifying general environmental hazards, they often fail to capture the nuanced risks inherent in specific patient care activities. This can lead to a lack of detailed understanding of how individual tasks contribute to patient harm. Implementing a methodology that only considers the likelihood of an event occurring, without adequately assessing the severity of its potential consequences, is also professionally unacceptable. Healthcare safety demands a comprehensive understanding of risk, where both probability and impact are considered. Ignoring the potential severity of a failure, such as a medication error leading to patient death, would result in a misallocation of resources and a failure to implement adequate safeguards for high-consequence events. Adopting a methodology that is overly reliant on historical incident data without proactive hazard identification is another failure. While past incidents provide valuable lessons, they do not encompass all potential future hazards. A proactive approach, which anticipates potential failures before they occur, is essential in a dynamic environment like healthcare. Relying solely on past events risks overlooking emerging hazards or new ways in which existing hazards can manifest. Professional reasoning. Professionals should approach hazard identification and assessment by first understanding the specific context of the healthcare environment and the tasks being performed. This involves selecting a methodology that is appropriate for the complexity and criticality of the activities. A systematic, step-by-step analysis of tasks, coupled with an evaluation of potential failure modes and their consequences, provides the most robust foundation for identifying and mitigating risks. Professionals should then consider the regulatory requirements and ethical obligations to ensure patient safety and compliance. When faced with multiple potential methodologies, the decision-making process should prioritize those that offer the most comprehensive and practical approach to identifying and assessing hazards relevant to patient care, ensuring that both the likelihood and severity of potential harm are thoroughly evaluated. Question 15. Stakeholder feedback indicates a desire to rapidly integrate a new advanced diagnostic imaging device into the hospital's radiology department. As the certified healthcare safety professional, CHSP, what is the most appropriate initial step to ensure regulatory compliance and occupational health and safety? Option A. Focus solely on the patient safety features outlined in the device's user manual, assuming staff safety is adequately addressed by standard operating procedures. Option B. Proceed with the immediate installation and use of the device, as the clinical benefits are prioritized by the requesting department. Option C. Review the manufacturer's clinical efficacy data to confirm the device meets diagnostic needs before any further safety considerations. Option D. Conduct a comprehensive risk assessment and hazard identification process for the new medical device, considering its operational environment and potential impacts on healthcare workers and patients, in alignment with applicable OHS regulations and healthcare safety standards. The correct answer is D. Conduct a comprehensive risk assessment and hazard identification process for the new medical device, considering its operational environment and potential impacts on healthcare workers and patients, in alignment with applicable OHS regulations and healthcare safety standards. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare safety, balancing the immediate need for a new medical device with the imperative of ensuring its safe integration into the existing environment. The professional challenge lies in navigating the complex regulatory landscape of medical device safety and occupational health without compromising patient care or staff well-being. A hasty implementation could lead to unforeseen hazards, while an overly protracted process might delay access to potentially beneficial technology. Careful judgment is required to ensure all regulatory requirements are met efficiently and effectively. Correct approach analysis. The correct approach involves a comprehensive risk assessment and hazard identification process specifically for the new medical device, adhering to established occupational health and safety OHS, regulations, and healthcare-specific guidelines. This includes evaluating potential risks to healthcare workers, e.g., exposure to radiation, ergonomic strain, electrical hazards, and patients, as well as ensuring compliance with relevant standards for medical device procurement, installation, and use. This proactive and systematic method ensures that potential hazards are identified and mitigated before the device is operational, aligning with the principles of the Occupational Safety and Health Act (OSHA) and relevant healthcare accreditation standards that mandate a safe working environment. Incorrect approach is analysis. Implementing the device immediately without a thorough risk assessment and hazard identification fails to comply with the fundamental OHS principle of proactive hazard control. This approach disregards the potential for unforeseen risks to staff and patients, violating the employer's duty of care under OSHA regulations. Procuring the device solely based on its clinical efficacy, without considering its OHS implications, overlooks critical safety requirements. While clinical benefit is important, it cannot supersede the legal and ethical obligation to ensure a safe environment, as mandated by various healthcare safety standards. Focusing only on patient safety aspects of the device, while neglecting the occupational health risks to staff involved in its operation and maintenance, creates an incomplete safety evaluation. Healthcare safety professionals must consider the well-being of all individuals within the healthcare setting, as required by comprehensive OHS frameworks. Professional reasoning. Professionals should adopt a systematic, risk-based approach. This involves 1. Identifying all relevant regulatory requirements, e.g., OSHA standards for equipment safety, specific healthcare guidelines. 2. Conducting a thorough hazard identification and risk assessment for the new device, involving relevant stakeholders, e.g., clinical staff, biomedical engineering, OHS specialists. 3. Developing and implementing appropriate control measures based on the risk assessment. 4. Documenting all steps and ensuring ongoing monitoring and review. This structured process ensures compliance, minimizes risk, and promotes a culture of safety. Question 16. Regulatory review indicates that a healthcare facility is considering implementing a new behavior-based safety program. Which of the following approaches best aligns with the principles of effective behavior-based safety and regulatory expectations for fostering a proactive safety culture? Option A. A program where supervisors are solely responsible for observing and documenting all unsafe behaviors, with a strict disciplinary policy applied to any employee found to be in violation of safety rules. Option B. A program where safety observations are conducted randomly, and the data collected is primarily used to identify specific individuals for retraining without addressing broader organizational factors. Option C. A program that focuses on creating a comprehensive list of all potential unsafe behaviors and requiring employees to sign off on understanding these behaviors without any ongoing observation or feedback mechanism. Option D. A program that emphasizes peer-to-peer observation of critical behaviors, providing immediate, constructive feedback and coaching to individuals, and using aggregated, anonymized data to identify trends and systemic issues for management intervention. The correct answer is D. A program that emphasizes peer-to-peer observation of critical behaviors, providing immediate, constructive feedback and coaching to individuals, and using aggregated, anonymized data to identify trends and systemic issues for management intervention. Explanation. This scenario is professionally challenging because implementing a behavior-based safety (BBS) program requires a delicate balance between fostering a culture of safety observation and avoiding a punitive environment. The Certified Healthcare Safety Professional (CHSP) must ensure the program aligns with regulatory expectations for worker safety and health, while also promoting genuine employee engagement and proactive hazard identification. The core challenge lies in designing and executing a BBS program that is perceived as a tool for continuous improvement and risk reduction, rather than a surveillance mechanism. Careful judgment is required to select an approach that maximizes effectiveness and compliance without alienating the workforce. The correct approach involves a structured, data-driven process that emphasizes positive reinforcement and collaborative problem-solving. This approach is right because it directly addresses the core principles of effective BBS programs, which are designed to identify and correct unsafe behaviors before incidents occur. Regulatory frameworks, such as those enforced by OSHA in the U.S., emphasize employer responsibility for providing a safe workplace and encouraging employee participation in safety initiatives. A BBS program that focuses on observation, feedback, and coaching, with a clear process for addressing systemic issues identified through behavioral data, aligns with these requirements. It promotes a proactive safety culture by empowering employees to be active participants in hazard recognition and control, thereby reducing the likelihood of injuries and illnesses. This method also provides valuable data for trend analysis and targeted interventions, which is a key component of a robust safety management system. An incorrect approach that relies solely on disciplinary action for observed unsafe behaviors fails to address the root causes of those behaviors and can foster fear and distrust, leading employees to conceal unsafe practices. This approach is ethically problematic as it punishes individuals without understanding the contributing factors and is unlikely to lead to sustainable safety improvements. It also risks violating principles of natural justice and due process. Another incorrect approach that focuses only on identifying and documenting unsafe behaviors without a clear mechanism for feedback, coaching, or systemic correction is also flawed. While observation is a component of BBS, without the subsequent steps of communication and intervention, it becomes an incomplete and ineffective process. This approach misses the opportunity to educate employees and address underlying organizational or environmental factors that may contribute to unsafe actions. A third incorrect approach that involves a top-down mandate for specific behaviors without employee input or understanding of the rationale behind the program is unlikely to gain traction or be sustained. This method disregards the importance of employee buy-in and can lead to resistance and superficial compliance. It fails to leverage the valuable insights and experience of frontline workers, which are crucial for the success of any safety initiative. Professional decision-making in similar situations requires a systematic evaluation of potential BBS program designs against established safety principles and regulatory requirements. This involves considering the program's impact on organizational culture, employee engagement, and its ability to generate actionable data for risk reduction. The CHSP should prioritize approaches that are collaborative, data-informed, and focused on continuous improvement, ensuring that the program serves as a genuine tool for enhancing workplace safety. Question 17. The control framework reveals that a healthcare facility has recently experienced a prolonged power outage. To ensure ongoing compliance with CMS regulations related to patient safety during such events, which of the following best represents a proactive approach to evaluating the facility's preparedness? Option A. Relying on the fact that the facility recently passed a general fire safety inspection, assuming this covers all aspects of emergency power preparedness required by CMS. Option B. Focusing solely on the technical specifications and maintenance records of the emergency generator without assessing staff competency or the plan's integration into daily operations. Option C. Reviewing the facility's emergency preparedness plan to confirm it includes provisions for emergency power, staff training on power outage procedures, and identification of critical patient care areas, and verifying that these provisions align with CMS requirements for patient safety during power failures. Option D. Accepting the facility's internal documentation stating that all emergency power systems are functional and that staff are adequately trained, without further independent verification. The correct answer is C. Reviewing the facility's emergency preparedness plan to confirm it includes provisions for emergency power, staff training on power outage procedures, and identification of critical patient care areas, and verifying that these provisions align with CMS requirements for patient safety during power failures. Explanation. The control framework reveals a common challenge in healthcare safety: balancing immediate patient care needs with the rigorous requirements of regulatory compliance. This scenario is professionally challenging because it requires a safety professional to interpret and apply CMS regulations in a dynamic environment where operational pressures can sometimes conflict with ideal safety protocols. The judgment required lies in understanding the intent behind the regulations and ensuring patient safety is not compromised while still meeting compliance standards. The correct approach involves a proactive and systematic evaluation of the facility's emergency preparedness plan against specific CMS requirements for patient safety during power outages. This includes verifying that the plan addresses the functionality and accessibility of emergency power systems, staff training on emergency procedures, and the identification of critical patient care areas that require uninterrupted power. The regulatory justification stems directly from CMS conditions of participation, (COPS), and interpretive guidelines, such as those found in 42 CFR Section 482. 22. Emergency preparedness and related appendices, which mandate robust emergency preparedness to ensure the continued provision of care and the safety of patients during emergencies, including power failures. This approach prioritizes patient well-being and regulatory adherence through a comprehensive review. An incorrect approach would be to rely solely on the facility's self-reported compliance without independent verification. This fails to meet the CMS expectation for demonstrable compliance and can lead to overlooked deficiencies. Another incorrect approach is to focus only on the physical infrastructure of the emergency power system without considering the human element, such as staff competency and training. CMS regulations emphasize the importance of trained personnel in executing emergency plans. A third incorrect approach is to assume that a recent inspection by another body automatically satisfies CMS requirements. While other inspections may cover some aspects of safety, CMS has specific requirements for emergency preparedness that must be independently assessed and documented. The professional reasoning process for similar situations should involve 1. Identifying the relevant CMS regulations and guidance documents pertaining to the specific safety concern. 2. Conducting a thorough assessment of current facility practices against these requirements, utilizing a combination of document review, interviews, and direct observation. 3. Documenting findings meticulously, noting any gaps or areas of noncompliance. 4. Developing a corrective action plan with clear timelines and responsible parties. 5. Implementing the plan and conducting follow-up assessments to ensure sustained compliance and continuous improvement in patient safety. Question 18. Process analysis reveals that a healthcare facility is struggling to consistently reduce healthcare-associated infections. High. To address this, the Safety Committee is considering different strategies for performance measurement and feedback related to infection control practices. Which of the following approaches best aligns with regulatory requirements and promotes a culture of safety? Option A. Establishing a punitive system where any staff member found to have deviated from infection control protocols faces immediate disciplinary action, regardless of the circumstances or potential system failures. Option B. Implementing a system that tracks HAI rates and provides regular, data-driven feedback to unit managers and frontline staff, focusing on identifying trends, root causes, and opportunities for process improvement, while also celebrating successes. Option C. Focusing solely on recognizing and rewarding staff for adhering to infection control protocols, without actively measuring or addressing instances where protocols are not followed. Option D. Utilizing HAI data primarily for annual performance reviews of individual staff members, with minimal direct feedback provided to teams or for system-level analysis. Correct answer is B. Implementing a system that tracks HAI rates and provides regular, data-driven feedback to unit managers and frontline staff, focusing on identifying trends, root causes, and opportunities for process improvement, while also celebrating successes. Explanation. This scenario presents a common challenge in healthcare safety, effectively measuring performance and providing feedback to drive improvement. The professional challenge lies in selecting an approach that is not only compliant with regulatory requirements, but also ethically sound and conducive to a positive safety culture. It requires careful judgment to balance data collection with the human element of feedback. The correct approach involves a multifaceted strategy that integrates objective data with qualitative feedback mechanisms, ensuring that performance measurement is tied to specific safety outcomes and that feedback is constructive and actionable. This aligns with the principles of continuous quality improvement mandated by regulatory bodies such as the Joint Commission, if U.S. jurisdiction is assumed for CHSP, which emphasizes data-driven decision-making and a culture of safety. Specifically, regulatory frameworks often require organizations to monitor key performance indicators related to patient safety, infection control, and environmental safety. Feedback mechanisms must then be designed to communicate these findings to relevant personnel in a way that promotes learning and accountability without fostering a punitive environment. Ethical considerations also dictate that feedback should be fair, timely, and focused on system improvements rather than solely individual blame. An approach that relies solely on punitive measures for deviations from established protocols fails to address the systemic issues that may contribute to errors. This is ethically problematic as it can create fear and discourage reporting, undermining the very safety culture it aims to foster. It also falls short of regulatory expectations, which often require root cause analysis and system-level interventions. An approach that focuses exclusively on positive reinforcement without addressing areas for improvement is also insufficient. While positive reinforcement is valuable, it can lead to complacency and a missed opportunity to identify and mitigate potential risks before they manifest as adverse events. Regulatory bodies expect a comprehensive approach to performance monitoring that includes identifying and correcting deficiencies. An approach that uses performance data solely for administrative purposes, such as staff evaluations, without providing constructive feedback for improvement, is a significant ethical and regulatory failure. This approach treats performance data as a tool for judgment rather than a catalyst for learning and development, which is contrary to the principles of patient safety and professional growth. It neglects the regulatory requirement to use performance data to enhance the quality and safety of care. The professional decision-making process for similar situations should involve a thorough understanding of applicable regulations, e.g., OSHA, CMS, the Joint Commission standards in the U.S., ethical principles of patient care and professional conduct, and best practices in performance management. This includes identifying relevant safety metrics, establishing clear performance expectations, implementing robust data collection and analysis methods, and developing a structured, constructive feedback process that supports a culture of continuous improvement and accountability. Question 19. Process analysis reveals that a large hospital is experiencing an increase in near-miss incidents related to medication administration and sharps injuries, despite having established safety protocols. The safety officer is tasked with improving risk communication and training to address these trends. Which of the following strategies will be the most effective in enhancing staff understanding and adherence to safety procedures? Option A. Focus all subsequent training efforts exclusively on the most severe medication errors and sharps injuries reported in the last quarter, assuming other risks are less critical. Option B. Develop and implement a comprehensive, multimodal training program that includes role-specific modules, interactive workshops, and regular competency assessments, coupled with clear, accessible communication channels for ongoing safety updates and feedback. Option C. Conduct a single, all-staff mandatory in-person training session covering general safety principles, with a brief overview of medication and sharps protocols. Option D. Distribute a revised policy manual electronically to all staff, highlighting the updated medication administration and sharps disposal procedures, and assume staff will read and understand the changes. The correct answer is B. Develop and implement a comprehensive, multimodal training program that includes role-specific modules, interactive workshops, and regular competency assessments, coupled with clear, accessible communication channels for ongoing safety updates and feedback. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare safety, ensuring effective risk communication and training in a dynamic environment with diverse staff. The challenge lies in translating complex safety protocols into actionable knowledge for all personnel, from direct patient care providers to administrative staff, while accounting for varying levels of prior knowledge and engagement. A failure in risk communication can lead to non-compliance, increased incidents, and compromised patient and staff safety, directly impacting the organization's ability to meet regulatory standards. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes clear, concise, and accessible communication tailored to different staff roles and responsibilities. This includes utilizing a variety of training methods, e.g., in-person sessions, online modules, hands-on demonstrations, to cater to different learning styles and schedules. Crucially, it emphasizes feedback mechanisms and ongoing reinforcement to ensure comprehension and retention. This aligns with the principles of effective risk management and the regulatory expectation for healthcare organizations to implement robust safety programs that include comprehensive training and communication, as often mandated by bodies like OSHA, Occupational Safety and Health Administration, in the U.S., which requires employers to inform employees about hazards and train them on protective measures. Ethical considerations also demand that all staff are adequately informed to perform their duties safely. Incorrect approach is analysis. One incorrect approach is relying solely on a single, generic training session for all staff. This fails to acknowledge the diverse roles, responsibilities, and existing knowledge bases within a healthcare facility. It can lead to information overload for some and insufficient detail for others, resulting in poor comprehension and application of safety protocols. This approach may not meet the specific training requirements outlined by regulatory bodies, which often necessitate role-specific training. Another incorrect approach is distributing written materials without interactive components or follow-up. While written communication is important, it is often insufficient on its own for complex safety information. Without opportunities for questions, clarification, or practical application, staff may not fully grasp the risks or the correct procedures, leading to potential breaches in safety protocols. This can be seen as a failure to adequately inform and train employees as required by safety regulations. A third incorrect approach is focusing training only on immediate, high-profile risks, neglecting less obvious but still significant hazards. Effective risk communication requires a comprehensive understanding of all potential dangers. Ignoring certain risks, even if they appear less frequent, can leave staff unprepared for a wider range of incidents, thereby failing to uphold the organization's duty of care and potentially violating regulatory requirements for hazard identification and mitigation. Professional reasoning. Professionals should approach risk communication and training by first conducting a thorough needs assessment to identify specific risks and the target audiences for communication. This should be followed by the development of a layered communication strategy that employs diverse methods, ensuring clarity, accessibility, and relevance to each staff group. Regular evaluation of training effectiveness through feedback and incident analysis is crucial for continuous improvement. This systematic approach ensures compliance with regulatory mandates and fosters a strong safety culture. Question 20. Research into a healthcare facility's exposure prevention and control program for bloodborne pathogens reveals that the primary strategy for preventing needle stick injuries during phlebotomy procedures involves providing staff with a variety of gloves and gowns. The facility has not invested in needleless blood collection systems or safety-engineered sharps disposal containers, and their training on safe work practices is conducted only once during initial onboarding, which approach best aligns with regulatory requirements for exposure prevention and control. Option A. Relying primarily on the provision of personal protective equipment, such as gloves and gowns, for all phlebotomy procedures, assuming that diligent use will adequately protect staff. Option B. Focusing on ensuring that all staff are aware of post-exposure prophylaxis protocols and have access to them immediately following any potential exposure incident. Option C. Conducting annual refresher training sessions that briefly review general safety guidelines without addressing specific engineering controls or the proper use of personal protective equipment. Option D. Implementing a comprehensive program that includes engineering controls like safety-engineered needles and needleless systems, robust administrative controls such as regular, task-specific training on safe work practices and sharps handling, and appropriate personal protective equipment as a last line of defense. The correct answer is D. Implementing a comprehensive program that includes engineering controls like safety-engineered needles and needleless systems, robust administrative controls such as regular, task-specific training on safe work practices and sharps handling, and appropriate personal protective equipment as a last line of defense. Explanation. This scenario is professionally challenging because it requires a healthcare facility to balance the immediate need for patient care with the long-term imperative of preventing occupational exposure to hazardous materials, specifically bloodborne pathogens. The challenge lies in implementing effective controls that are both practical for daily operations and compliant with stringent regulatory requirements designed to protect healthcare workers. Careful judgment is required to select the most appropriate control measures that minimize risk without unduly hindering patient treatment. The correct approach involves a multifaceted strategy that prioritizes engineering controls, followed by administrative controls, and finally, personal protective equipment, PPE. This hierarchy of controls is a fundamental principle in occupational safety and health, mandated by regulations such as the Occupational Safety and Health Administration's OSHA, Bloodborne Pathogen Standard, 29 CFR 1910, 1030, Engineering controls, like needleless systems and safety-engineered sharps disposal containers, are the most effective because they physically remove or isolate the hazard. Administrative controls, such as comprehensive training programs on safe work practices and proper handling of contaminated materials, are crucial for reinforcing safe behaviors. PPE, such as gloves and gowns, serves as the last line of defense. This systematic approach ensures that exposure risks are addressed at their source, minimizing reliance on individual worker compliance with PPE use, which can be variable. An incorrect approach that relies solely on providing personal protective equipment without implementing engineering or administrative controls fails to meet regulatory requirements. OSHA standard emphasizes that PPE should be used when engineering and administrative controls are not feasible or do not reduce exposure to a safe level. Relying solely on PPE places the burden of protection entirely on the individual worker and does not address the inherent hazard of the equipment or procedure itself. This approach is ethically questionable as it prioritizes cost saving or convenience over the robust protection of employees. Another incorrect approach that focuses only on post-exposure prophylaxis without robust exposure prevention measures is also unacceptable. While post-exposure prophylaxis is a critical component of a comprehensive bloodborne pathogen program, it is reactive, not proactive. Regulations require facilities to implement measures to prevent exposure in the first place. Relying solely on prophylaxis after an exposure occurs is a failure to adhere to the primary mandate of hazard control and worker safety. A third incorrect approach that involves infrequent or superficial training on safe handling practices, without a commitment to implementing and maintaining engineering controls or ensuring proper PPE use, is also a significant regulatory and ethical failure. Effective training must be comprehensive, recurring, and tailored to specific job tasks. Without consistent reinforcement and the provision of appropriate control measures, training alone is insufficient to prevent occupational exposures. The professional decision-making process for similar situations should begin with a thorough hazard assessment to identify potential exposure risks. This assessment should then inform the selection of control measures based on the hierarchy of controls. Facilities must consult relevant OSHA standards and guidance documents, such as those pertaining to the bloodborne pathogen standard, to ensure compliance. Regular review and evaluation of the effectiveness of implemented controls, along with ongoing employee training and feedback, are essential for maintaining a safe working environment and preventing occupational exposures.